If you found your way to this video, there is a good chance that pain is part of your life in some way. And if that is the case, you may be thinking that if something hurts, something must be wrong in the body. Now, sometimes that is true. There are types of pain that are directly linked to ongoing physical processes in the body. So, for example, conditions like rheumatoid arthritis, where there is active inflammation, perhaps, as well as tissue involvement, or even injuries where something clearly needs time to heal. So, pain can absolutely reflect real physical changes or damage. But when it comes to chronic pain, things tend to become a lot more complicated because one of the biggest misunderstandings, and perhaps one that causes a lot of distress, is the idea that pain always reflects ongoing damage in the body. And in many cases, it simply doesn't. What we now understand is that pain is not created in the tissues alone. It's created by the nervous system, and more specifically, by the brain. That doesn't mean pain isn't real. It means the process behind it is way more complex. Your brain is constantly taking in information from the body, from past experiences, from stress levels, and also from the environment. And it uses all that information to decide whether something is dangerous. So pain in that sense is actually protective. Now, in acute situations, that system works very well. But in chronic pain, the system can become overprotective. It can become more sensitive and more reactive, almost like the volume has been turned up. And when that happens, you can experience real ongoing pain, even when there isn't clear or ongoing tissue damage to explain it. So this is where we start to see terms like neuroplastic pain, central sensitization, and nervous system dysregulation. And while those terms can sound quite technical, what they're really pointing to is a system that has learned to stay on high alert. And importantly, this doesn't mean that your pain is all in the head. It means your body and nervous system are doing exactly what they've learned to do, to protect you. Sometimes in response to injury, sometimes in response to stress, and sometimes in response to experiences that have shaped how safe or unsafe the body feels over time. And for many people, it's not one or the other, like some degree of structural or inflammatory change in the body, and also a nervous system that has become sensitized. And that combination can amplify the experience of pain in a very real way. The difficulty is that many people are still giving very structural explanations for pain. Things like wear and tear, degeneration, or even findings on scans. And while those things can be relevant, they don't always explain the level of pain someone is experiencing. So we know, for example, that many people have significant changes on scans with no pain at all. And others have severe pain with very little physical damage showing. So there isn't always a clear match. And when that mismatch isn't explained properly, people are often left feeling confused, or even like their pain doesn't make sense. So a big part of what I want to do with this channel is to help make sense of that, to talk about pain in a way that reflects what we now understand, which is that it's influenced by the body, the nervous system, and our experiences, not just one single cause, essentially. Because when we understand pain differently, we can also start to approach it differently. And that's when things begin to shift. Now, in the next video, I'm going to talk more about something called mind-body syndromes, what that actually means, and just as importantly, what it doesn't mean. Because this is often where a lot of confusion and sometimes frustration comes in. But for now, if this video resonated with you, you are very welcome here. And if you like this video, please hit the like button and please subscribe if you feel like it. And hopefully I will see you in the next video. Thanks for watching.